My special guest today is Dr. Michael Holick. Dr. Holick is an endocrinologist, professor of medicine, physiology, and biophysics. Dr. Holick is also the director of the General Clinical Research Unit and the director of Bone Health Care Clinic and the Heliotherapy, Light, and Skin Research Center, all located at the Boston University Health Center. The Bone Health Clinic provides comprehensive evaluation and treatment programs for children and adults with various metabolic diseases, such as osteoporosis and osteomalacia, and those with connective tissue disorders, such as osteogenesis imperfecta and Ehlers-Danlos syndrome. He has recently co-authored the paper, Bone Fragility and Hereditary Connective Tissue Disorders, a Systematic Review and Meta-Analysis. The review and analysis included bone fragility in patients with hereditary conditions, including Ehlers-Danlos syndrome, Marfan syndrome, and Loeys-Dietz syndrome. It is a privilege to introduce you to one of the world's leading authorities on hereditary connective tissue disorders and bone health. I bring you Dr. Michael Holick. Welcome, Dr. Holick, and thank you for joining me.
It's a pleasure to be here.
So you recently authored a paper, and it, for a lot of individuals, connective tissue disorders is a term that they're not familiar with. But what they might be more familiar with is terms like being very flexible or having very loose joints or being able to do all of the different yoga poses because they're double jointed. Those kind of terms are familiar to individuals. And maybe if you don't mind talking about how there's a spectrum of connective tissue disorders and how that affects our bones.
So we're mainly going to be talking about Ehlers-Danlos syndrome, hypermobility type. And so I have a large questionnaire that I ask my patients to get an insight as to whether or not they may or may not have this genetic disorder. Because there are a multitude of medical conditions that are disparate that patients would just kind of accept in life because doctors don't know how to deal with it. And only when they see me and I explain to them what's going on, is kind of light bulb turns on. And it gives them great relief. Yeah. Because now they realize they're not crazy, that these are real symptoms, that they're not in their head. And so I'll give you some examples. Typically, patients with Ehlers-Danlos syndrome, everything in their body is stretchy. And so as a result, these individuals, when they stand up quickly, feel lightheaded and their heart beats fast in their chest. And the reason is that the blood vessels can't constrict as quickly. Their nervous system is not working correctly. And as a result, the blood flows out of the brain. They feel lightheaded. And as a result, they learn over time to get up more slowly. When they explain this to their doctor, the doctor said, "Oh, you're probably just dehydrated, drink more water." And of course, that doesn't do anything. Another interesting medical condition is that often these patients will turn red-faced or sweat profusely without any provocation. This is what's called mast cell hypersensitivity. Reasons that we don't understand is that the mast cells, which are immune cells that release histamine, like if you get a bee sting, causes vasodilation of your blood vessels. So you feel hot, and in certain circumstance you feel kind of embarrassed because it looks like you're embarrassed for some reason, but it's due to mast cell hypersensitivity and can be controlled with an antihistamine. They often have poor wound healing. It's very important for surgeons to be aware if you have this disorder, because I've had many patients that have had a surgical procedure and they sew them up, but they don't realize that the underlying tissue is not very stable and will open up. They often will complain of migratory aches and pains in their bones and muscles and joints. this is what's called regional chronic pain syndrome.
Okay.
And it's associated with what's called dysautonomia, where there's an alteration in your sympathetic and parasympathetic nervous system. And again, you explain this to your doctor. I have these pains, they're coming and going. I don't know what's causing it, right? And they work them up for rheumatoid arthritis, which is negative. They can't figure out what's going on. So they usually say you're doctor seeking or drug seeking. These patients, their joints click. Many patients that when they're very hypermobile, they'll actually have partial, what's called subluxation, partial dislocation of shoulders or hips. I have one patient, she gets up in the morning and her hip is dislocated. It can be that significant
That
and
is,
severe,
mm,
right? And then also, what's equally remarkable is that both children and adults with this genetic disorder have a 10 times higher risk of fracture for the same amount of trauma that will not cause a fracture in an otherwise healthy male or female matched for sex and age. And I'll just give you an example. I got a frantic phone call from my orthopedic surgeon. His neighbor became apoplectic because she had a
could you
17.
explain what that is?
Yeah, apoplectic means crazy, not knowing what to do.
Okay.
And the reason was that her son, 17, was going to be heading off to college, and he put on his backpack and felt a very intense pain in his upper spine. They took an X-ray and they found that he had fractured. Well, that's understandable, right? Because you put on a heavy backpack, right? That can cause that. That wasn't what concerned the mom. No, no, no.
Okay.
When they took the X-ray of his entire spine, they had found that he had multiple fractures
Oh, wow.
that he never knew about. And the problem is that if you have a fracture of your spine where you're compressing your spine, you'll have an acute pain that resolves over a period of 2 to 3 weeks. So you think it's just a muscle ache and you don't give much thought to it. But yes, patients with Ehlers Danlos syndrome, hypermobility type, are at 10 times higher risk of fracture. And this also occurs in infants. And as a result, many families have been charged with child abuse when it wasn't appreciated that they, in fact, have this genetic disorder. And I've been writing about this and helping families be reunited by actually seeing them and helping them through the process and trying to convince the courts that, in fact, there is a explanation for this. They also have easy bruisability.
Okay.
And again, for children, this is incredibly important for parents to recognize because if their child bumps their head and they have Ehlers-Danlos syndrome and easy bruisability, they could be bleeding in their head. That can then lead to major neurological disorders and even death. So for me, I'm always on the lookout for patients with this genetic disorder. I explain to them why they have all these, like I said, crazy disparate symptoms, and I advise them how to deal with many of them. So, for example, if your joints are clicking, right, what's going to happen is that you're going to destroy the articular cartilage, right, Teflon around your joint. So I tell parents, but I also tell them themselves that just like athletes that stabilize their joints with soft bracing, you should do the same. You don't want your joints to click, right? And for your child, ACE bandage or some kind of bandage to help strengthen ankles and knees and wrists can be very helpful because otherwise, earlier in life, they're going to wind up with early onset osteoarthritis.
And in that group, only because so being hypermobile and my son and daughter are both hypermobile, and my son wanted to play rugby and would, self-manipulate his cervical spine all the time. Um, I, I don't know if you would agree, but strengthening seemed to be such a benefit for him because it reduced his range of motion, built up the muscle as a protection to the joint. Um, so if you want to comment on
Oh,
strengthening when the
unequivocally,
child is,
I recommend physical therapy and absolutely strengthening the muscles around all your joints will help protect them. One of the other consequences is that they often have a TMJ problem where their jaw will click or sometimes even get stuck, right? And again, this is all associated with this genetic disorder. Yeah. And
And
also,
so there's a large spectrum of hypermobility that people could be on, and they could just have a few symptoms that you mentioned, but still have, you know, large repercussions.
well, not only that, but even if it's a young adult and they don't have very many, their infant may very well have. Because another symptom is what's called gastroparesis, where your gastrointestinal, the intestine slows down and it could cause either diarrhea or constipation. It causes abdominal pain. These patients prefer to eat small meals because it's uncomfortable to eat a big meal. And infants will spit up if they're being fed because their stomach blows up like a balloon and it gets so uncomfortable and collapses.
Hmm.
And the simple fix is to give smaller feedings multiple times a day, right? Rather than giving them a medication that often pediatricians will give them saying that they have gastrointestinal reflux. It's not true.
Okay. Wow. And so there are, and as you know, your paper indicated quite a number of genetic disorders, and I understand your hospital discovered another genetic disorder in 2021 that had not been identified yet. So congratulations.
You're kind. So it's a gene that was observed, but we were the ones that identified it causing 23 fractures in utero. In utero.
Wow.
Mom, yeah, because I had seen this mom, and this is another complication of EDS, is that she had poor healing of a fracture in her arm. And so I put her on a potent medication and I told her, if you get pregnant, stop it. And then after pregnancy, I'll put her back on. So I called her up after her pregnancy and I said, how are you and your son doing? And she said, oh my heavens, my son had fractured both arms, both legs, most ribs in utero. He had 23 fractures in utero. And so I got to see the family in our clinical research program. I got their DNA and we did whole genome sequencing and identified a gene that's responsible for that bone fragility in that infant.
So I know that for individuals in Canada and even in the US, it is hard for them to seek or to find medical professionals, as you mentioned, that can identify and associate their symptoms to these genetic disorders. So if you could just provide these individuals with some recommendations, suggestions, especially if they don't live in the Boston area, as to what steps they can take to seek help.
Right. I mean, I just got a phone call yesterday from a young woman in the Boston area seeking help. You basically cannot find very few physicians that understand this disorder at all. And many physicians run, basically. When you come in, tell them that you have EDS because there's so many medical conditions and they just don't want to deal with it. And so I have a website right now, and on there I list all types of symptoms, and I'm going to put my checklist on that they can go to. But if you have many of these symptoms, it's very likely that you have a genetic disorder of your collagen elastin matrix, and the most common is Ehlers-Danlos syndrome hypermobility type. And just like you said, many only have mild symptoms, but some will have severe symptoms. And under those circumstances, if you're able to find a good physical therapist or a physiatrist, right, that has a better understanding of this, is wise to seek out.
Okay, so we'll list the name of your website so people can
Yep.
use that
So,
as a primary resource.
yep. So at the moment, it's called EDS Research project.org. But
Okay.
we're now upgrading it and it's probably going to change a little bit. But right now, if you go to that, you'll get to see it. And you'll also read about the families I've helped who have been falsely accused of child abuse. That's a very obviously big deal.
Yeah. Okay. Well, once again, thank you so much for sharing your knowledge. I can see why you don't feel like you could retire. Um, so the
Yes.
world needs you and your knowledge. And thank you for being there for these individuals.
My pleasure. And then would you believe with one last thought, right? So since we talked about EDS at Ehlers Danlos syndrome and bone health, is you need to make sure that those individuals are also getting adequate calcium and adequate vitamin D, right? Along with good exercise.
So we'll make sure we link to our first conversation on vitamin D. Thank you
Exactly.
so much.
My pleasure.
To learn more about Dr. Holick's work and website, go to the description box below. Go here to check out our hypermobility playlists. Thank you for joining me today.